At least 6 people have died in an outbreak of the new coronavirus, which has now reached the United States. The Centers for Disease Control and Prevention has confirmed the first U.S. case has been detected in Washington state. The patient, who is in isolation, recently returned from Wuhan, China, where the SARS-like respiratory illness was first detected last month.
Tell us the significance of this new development.
Yeah, absolutely. So obviously it's a scary headline to see, but the fact that this is 2 people that were in close contact, the sort of situation where you might, sort of assume would be the most likely kind of transmission to happen, that's pretty reassuring. It's not like we're seeing, cases pop out of nowhere. This is something I imagine the CDC was already watching. They're looking at people who have traveled to China, those close to them. So I wouldn't say this should dramatically alter anyone's opinion of how serious this is.
I mean, for those who live in the United States, we're particularly focused on what happens in the United States. But did we basically understand people could transmit it to other people in China, for example? Is that a development?
We already understood that's what's happening.
See.
Yeah, so this can be transmitted via droplets. The question is how easily that happens. That's still open, whether it can happen when people aren't showing symptoms. But we are getting the sense that is something that happens with some frequency. The fact that this is not so severe might be a potential avenue for further transmission. So on one hand, you're sort of reassured by the fact that the death rate isn't that high, but the fact that it isn't so serious means that it could go pretty far without people actually noticing too much.
Tonight, the U.S. is closed to most foreigners who've traveled recently to China. As a 9th case is confirmed in the U.S., the president telling Fox,
No, we've offered China help, but we can't have thousands of people coming in who may have this problem, the coronavirus.
any remaining flights from China with U.S. citizens will be routed through 11 airports with advanced screening capability.
The first in the deadly coronavirus outbreak. The U.S. Embassy in Beijing confirmed overnight that the first American has died from the virus at the epicenter in the Chinese city of Wuhan. The outbreak is responsible for more than 720 deaths. All but 2 have occurred in mainland China. More than 34,000 people have been infected with the virus worldwide, including at least 12 confirmed cases of the virus right here in the United States.
Well, this is Loma Linda University Medical Center, and this is the emergency room entrance, but look what's right across from it. This tent that has been set up, they are using it. They've used it in the past for flu patients, but now they're using it to determine if someone might have the coronavirus. Once you come inside, you have the bed here, you've got some cots, just a triage area. And of course, the first thing they do is they check your temperature. Standard protocol if you're determining whether or not someone has coronavirus. Listen, this is the area where within the last 48 hours, you had more than 100 Americans come via plane from Wuhan, China. They arrived here, and hospital officials said, because they are here, let's mobilize our tent and prepare it just in case.
Well, tonight, the King 5 investigators have more information following their report that the King County Public Health Department has sent some patients with suspected COVID-19 to a local motel. That is the new name for coronavirus.
So the county says that is what is necessary when someone needs to be isolated, but they don't have anywhere else to go. So now we found that the first responders who transported at least one of those patients were not warned of the potential risk. King 5 investigator Susanna Frame is here with the very latest on this. Susanna.
Mark, the county insists that when they need to use a motel to isolate a suspected case, the other guests and the employees and the public are safe. But now we found the EMTs who took at least one patient to a motel were not given the right information to make sure they were safe as well.
When EMTs with American Medical Response Ambulance Company got orders to pick up a patient in Seattle on Saturday, the directions were suspicious. The King 5 investigators have obtained the call logs from that ride. Dispatchers telling the crew to put a mask on the patient's door and knock, then go back to the ambulance. The patient will get into the back of the rig alone. No need to make any contact. Just drop him off at a specific local motel in King County, about an hour outside of Seattle. The directions were strange enough that the EMTs wrote back to dispatch asking, "Is this patient suspected of having a contagious infection?" Answer, yes. Coronavirus? Answer, unknown. We found King County public health officials did ask for that transport, and they confirm the person was a suspected coronavirus case, and that those EMTs should have been fully briefed on what they were dealing with to protect themselves.
And so when first responders are not notified, what do you think of that?
Something went wrong in the system, that there was something fell through the cracks.
Dr. Jeff Duchin is the top doctor at King County Public Health.
Any healthcare professional, including EMS, should be aware that they may be evaluating a person suspected to have this infection.
AMR employees took to a closed Facebook group this week, furious their coworkers were potentially put in harm's way. The communication breakdown is dangerous and could worsen the chance of spreading this disease, wrote one EMT. Another wrote, "This is such a horrendously neglectful job of communication. This should not be happening again and should not have happened in the first place." And by phone, another EMT told me, "It was super upsetting. We're angry. It makes me feel like they don't care about us, like we're just disposable." AMR executives didn't explain to King 5 what went wrong, just that they follow protocols. But in the case headed to the motel,
There's really little to no risk going in our community at this point. But there may be a time where this infection does become more common in our community, and so this is really important, and it's a good opportunity to review our procedures.
So to their credit, the EMTs were spooked enough on Saturday that they ended up stopping and putting on protective gear on their own accord, and then they decontaminated their rig afterward, again, on their own volition. It's clear from talking to the EMTs that they felt very let down by their company, and they hope to get all the information that they need in the future. And by the way, after we did that interview, we do know that the county reached out to AMR and said, you know, we need to step it up here and do the right thing. Yeah.
Wow. So, Susanna, what are the latest numbers of COVID-19 here?
17 people in King County have been tested. Every test, they've all come back negative.
Okay, so I have a breaking news story, and I want to give a big shout out to the people that are emailing me about this and sending me these stories. Thank you very much. So, CDC in America finally admit, like I've been saying this whole time, there's about 600 people in New York self-quarantine. I've been saying this the whole time, but WIVB, Channel 4 News in Buffalo, they've been slandering me. They've been threatening me. I've been getting death threats over this. This is the truth. 575 people at least quarantine in New York. I've been saying this the whole time, but the media has had their damn heads in the sand and they won't listen, and they've been calling me the liar. But you guys know the truth. You guys have been sending me these stories, and this is the truth. At Shrimp Zoo, we're reporting on the real truth. We're not the stupid media that's lying to everybody. Finally, the truth has came out. California, 6,000 people in quarantine. New York, 600 about. And this is just the tip of the iceberg. These aren't even still the real numbers, guys.
Acting out of an abundance of caution, the County of San Diego is taking an administrative action by declaring both a local emergency and a public health emergency.
County of Santa Clara has declared a local emergency due to the coronavirus. Officials say the move will allow them to receive state funds and resources that will help them respond to the outbreak. So far, there have been 2 reported cases of the illness in Santa Clara County.
With the continued rise of the coronavirus across the world, we need to allocate more resources to make sure that we are prepared. We need more help to do outreach to the community and to put those resources to work today. We need to take an official action. And that's why today I'm proactively taking a step to strengthen our preparedness for what may come by declaring a local emergency for coronavirus. In a little bit, we will hear from our Department of Public Health and the Department of Emergency Management about what this actually means. But I want to affirm and reassure our communities that there are no confirmed cases in San Francisco. To be clear, this declaration of emergency is all about preparedness. It's all about preparedness. The CDC has already acknowledged the importance of preparedness in advance of an outbreak. And by declaring a state of emergency, we are prioritizing the safety of our communities by being prepared. While we have no active cases in San Francisco at this time, we are focusing our efforts on protecting the people who live and work here.
Based on what we know right now, we believe the immediate risk here in the United States remains low, and we're working hard to keep that risk low. But we must use this time to continue to prepare for the event of community transmission in the United States. Part of that preparation is educating the public and our state, local, and private sector partners about what transition from aggressive containment measures to community measures or community mitigation would look like should we end up there. Under our current aggressive containment posture, patients infected with the coronavirus who have mild or no symptoms are being placed in healthcare facilities for very close observation and isolation. That intensive level of medical care is not typically needed. As we've watched these cases and learned over the past several weeks, we realize that other approaches to management are likely fine. Outside this period of aggressive containment, the usual and appropriate care for most patients who develop the novel coronavirus or COVID-19 would be management at home through home isolation, with use of healthcare facilities only as needed for those who have severe presentations, the elderly, those with medical conditions requiring closer observation. We will maintain for as long as practical a dual approach where we continue these measures of aggressive containment to this disease, but also employ strategies to minimize the impact on our communities. However, current global circumstances suggest it's likely that this virus will cause a pandemic. In that case, risk assessment would be different, and new strategies tailored to local circumstances would need to be implemented to blunt the impact of the disease and further slow the spread of the virus.
Other than yesterday, which was something pretty bad with respect to the virus, and we'll see what happens. I see the futures are up today, up fairly substantially, but that's a very serious thing, but we think we're in very good shape in the United States. We've essentially closed the borders to areas where we had to close them, and we had very few. We took in 32 people over the last 2 days because they were sick, and they're Americans, and they're great people. You know, what are you going to do? They're in quarantine, but we had essentially 12 people. Many of them are getting better now. Soon they'll all be better, we hope. And we're watching very carefully. So we've had a very, very good stretch of, let's just say we're fortunate so far, and we think it's going to remain that way. China is working very, very hard. I've spoken to President Xi, and they're working very hard. And if you know anything about him, I think he'll be in pretty good shape. They've had a rough patch. And I think right now they have it, it looks like they're getting it under control more and more. They're getting it more and more under control. So I think that's a problem that's going to go away, but we lost almost 1,000 points yesterday on the market, and that's something, you know, things like that happen where, and you have it in your business all the time, had nothing to do with you. It's an outside source that nobody would have ever predicted. If you go back 6 months or 3 months ago, nobody would have ever predicted. But let's see, I think it's going to be under control, and I think I can speak for our country. For our country is under control. But again, we do business with a lot of other countries. We take care, we work with other countries. We want other countries to be happy, healthy, and well. They've got to be happy, healthy, and well. It's very simple. And so let's see how it all works out, but I think it's going to work out fine. I hope so. We're working very hard. We're spending a tremendous amount of money also on, we just asked for $2.5 billion on getting everything ready just in case something should happen, and also helping other nations that really aren't equipped to do